Well, health experts will front the Senate inquiry into Australia's coronavirus response today, where the AMA will call for the establishment of an independent National Centre for Disease Control. So the push comes as Australia records its first COVID-19 related death in more than a month, and Victoria experiences a surge in cases. Well, joining me now is the AMA President, Dr. Tony Bartone. Doctor, good to see you. Thanks so much for joining us. So first of all, the National Centre for Disease Control that you are pushing for, so what would that allow that's not already in place?
Good morning, Peter. A CDC would really effectively bring together all the good points that we've seen through the recent months that have been happening with the workings of AHPPC. That committee, that group of people have come together and have worked diligently to assist Australia through that first wave of COVID-19. But we need to understand that there's nothing tying that together. That's only a significant amount of goodwill and good intentions, but there's no formal act, there's no formal regulation that brings them all together and gives them the ongoing funding, the ongoing ability to prepare during the quiet times, to do the research, to do the planning, the coordination, and indeed make sure that, as we've seen with COVID-19 and previous epidemics, they will come back. There will be more in the future, and we need to be ready and prepared as best we can for them.
Okay, just on to Melbourne, as we just talked about, Doctor. We have seen that spike now for a number of days in a row. It's worrying a lot of people. What are your observations about what's going on in Melbourne?
Well, clearly, right from the beginning, we always knew as the restrictions were being relaxed, that there would be the opportunity, there would be the possibility of some outbreaks. There'd be sporadic, localised outbreaks, and they would need to be managed very quickly, very, very intently. Now, this is what we've seen here. It could have happened in any other city, but it's happening in Victoria, and there are a couple of reasons perhaps underlining what has gone on there. Indeed, the security contractors at those quarantine facilities for returning repatriated Australian citizens, who indeed some of them have had COVID-19 because they're coming back from hotspots all over the world. Clearly, there's been some breakdown in those facilities, and that has led to some of the families of those security personnel in the community then becoming infected. But it's clearly the same messages do still need to be remembered, that if we become complacent, if we forget to social distance, if we become complacent about hand hygiene, cough etiquette, if we go to work when we've got some symptoms, if we don't get the testing and in testing in significant amounts when we've got symptoms, we're still going to see things like what we're seeing in Melbourne being replayed again and again before we finish up with COVID-19. And indeed, this will continue until we get a vaccine.
The Army is being deployed to those hotspots. Do you support that?
Clearly, what we've seen in the last few days is that there's, especially with more than 1,000 contacts of all the cases going at the moment, there is a real pressure on the contact tracing personnel, the private investigators that look at how the disease is being spread. There's a significant amount of logistical demand on the testing sites, and there's also the issue around the security personnel at the quarantine facilities. And this is clearly where the ADF can provide both logistical support, it can provide obviously experienced and qualified assistance at in terms of security at the quarantine facilities, and it can also help with the ability to be deployed in those various areas where we're seeing pressure in terms of logistics and the response.
Because when you see that, when you see the Army being deployed to the hotspots, it all of a sudden ratchets up a fair bit and gets people's attention. It's almost as if this has become even more serious than what it already is, and I'm guessing you're supporting that. How much of a difference can it make?
Well, as you correctly point out, it sends a very clear visual message about the importance and the acuteness of the degree of severity of the threat. We need to jump on this before it becomes a second wave. The next couple of weeks are crucial in our response. This will obviously send the key message, the key information to everybody that we still have a virus prevalent in our community. We do need to take it seriously. We can't be complacent, and indeed they'll assist the on-ground response right through the community.
Well, I mean, you're talking about that second wave, and it certainly does seem to be happening right around the world at the moment, Doctor. You're seeing those numbers skyrocket in the US, Latin America, Central America, India, just to name a few sections of the world. I mean, when you're talking about international travel into Australia, there's so much talk about that basically not happening this year. I mean, there's good reason to suggest now, and I'll get your view on this, that it may well not happen next year as well. Would you agree?
Peter, until we really have a vaccine, it's really unlikely to see how we can really effectively reinstitute the international travel to the degree that we were used to in the past. It's going to be a significant amount of time, certainly well into the early parts of next year before I can see any ability to look at that. It's going to be determined by both vaccine development and availability and ability to spread that through the wider populations, but also indeed additional therapies to combat COVID-19. We need to understand that we have a natural advantage of being an island continent, and that the only way we can really effectively ensure that we continue the process of suppression and protecting the Australian community is by controlling our international borders. And it doesn't, as we've seen from the numbers, 150,000, 160,000 new cases a day, 10 million cases by the end of this week, the World Health Organization is predicting. It's no sign of letting up its upward glance already.